We've got a few minutes because I just wanted to pick up before we move into the next round of workshops something on framing. Now, there's an organisation called Frameworks Institute who last week, which unfortunately I only found out this morning, published a paper on framing around alcohol and a way to do that. And the idea of framing is it's how you, I suppose, present an issue to the public. Now, often in public health, I think we're seen as the health or the fun police, actually. Everyone calls us a fun police because we ruin people's fun, we stop them doing the stuff they want to do. And there's a real skill to how you get the messages out. And if you think of some of the public health campaigns of the past, they're all very much focused on danger. If you think about the AIDS, HIV campaigns, a lot of the smoking stuff, all very harm focused. And there is a bit of evidence out there that if you frame things in a different way, and often a more positive way, you might get a different response from the public. And so a lot of the work, for example, in psychology of around things like, smoking, it's about taking something away from you. Whereas if you look at the cognitive behaviour approaches to some of that, it's actually about what's positive, what's the benefit, and you don't focus on the negative, you focus on the positive and the benefit and the framing. And one of the conversations we had at an early stage was how could we create a frame around alcohol that is more positive and less negative in terms of talking about all the harms and the dangers and the bad things that happen as a result of alcohol. But what are the positive things that can happen by reducing consumption, or by, for example, if you want to frame around increasing tax or minimum unit pricing? If it's seen at an individual level, it will cost people more. Generally, people won't be supportive of that. But if you frame it in a way about how do you direct resource into communities who have the highest levels of need, and you frame it as an equity challenge, then you get a different public response to that and people engage in it in a different way. Now, the Frameworks Institute, and we'll send around the link. I had a nice QR code so you could have scanned the report if the slides ever appear. I think starts to do that, and it's based on a sort of a US audience, which I think is slightly different to our UK audience. But I still feel like some of the things really apply, and particularly how we use equity arguments to make the case around alcohol and our licensing, and how we work with communities around understanding the impact of licensing decisions and how they directly impact on our communities, how we use the data that we have around health, care, criminal justice system, violence, and how alcohol is a driver of some of those things, and frame them in a way that maybe brings the public with us a bit more.